Welcome to my channel Healthy Life with you. Today we will going to discuss what are the precaution which kidney patients should take. Let's start now with the first item. We are having a protein intake. So normally as a kidney patient we also should have to define that, right, to how much protein we should have to intake on daily basis. If you are if you are a dialysis person, then you should have to take more proteins, right? Because you also have a higher protein needs because your body uses more energy when you are on dialysis. And if you are not on dialysis, then the recommendation of for protein intake is to based on your weight, how much weight you are having. So let's say if you are having weight is 60 kg, then multiply by 60 kg, multiply by 60, 1.2, it's become 72, as you are seeing on the screen, right? So it becomes 72 gram of protein you should have to intake on, or you should have to eat on daily basis, right? If you are eating more than that, then definitely your creatine will get increased. Now let's move on to the next item. We are having salt. So normal people should consume a salt around 2300 milligram to maintain the healthy blood pressures, right? So for individual with a kidney disease or high blood pressures, 1500 milligram of salt may be a more appropriate for either a kidney patient or a high blood pressure patient person. Always consume a pink salt or rock salt, because the reason is, if you are utilizing a normal salt, then definitely in the normal salt having a high sodium in content in that. And if you are eating rock salt or pink salt, then in that around 3 to 4 milligram of sodium content is little less as compared to normal salt. So you should, if you are having a kidney problem or having a blood pressure, then you should have to eat a rock salt, we also called as pink salt, or might be as a senda namak, right? So if you are eating more than that, then definitely your blood pressure will get increased, and also it will get impacted in your kidney disease as well. Let's move on to the next slide. Now in the next slide, if you see how much potassium we should have to eat, right? So definitely as a kidney patient we should have to avoid high potassium fruits or vegetables. So for that, as you are seeing on the screen, so potato and sweet potato we should have to avoid it, for maintaining the potassium level in the body. And also in the potatoes and the spinach, right, in the banana, green vegetables, beets, tomatoes, these all the foods or vegetable, we can say, having a high potassium things. Okay, so you should have to avoid if you are having a kidney problem. Now next is phosphorus. As you know that phosphorus we will get in the dairy foods, like we are having a milk or curds, right? So in that having very high content of phosphorus, even also in a with dry nuts also, right? So badam, right, almonds and all those things, there are a lot of dry nuts which having a high phosphorus content. Also phosphorus is also available in the meat, so you make sure to avoid these all those three things, that is dairy food, nuts, dry nuts and meats. Now let's move on to the last but not the least, water intake. So if you are having a kidney problem, so make sure to drink only a raw water, or we can also say is a filtered water, right? So some studies have shown that the frequent dehydration, even if it's mild, may lead to a permanent kidney damage. It means that if you are having a dehydration, definitely it will get impacted to the kidney and it will permanent damage to the kidneys. Okay, so dehydration can cause a buildup of waste and acid in the body, and it can clog the kidneys with the muscle proteins. All these things can hurt the kidneys. The National Kidney Foundation recommend for people with stage 1 and stage 2 chronic kidney disease to consume 8 glasses of water per day, and those with having a kidneys third, fourth and fifth stage CKD to limit the water of. Also consult with your doctor before taking this water. It is best to discuss your water and salt consumption with your doctor. Thank you so much. If you like this video, please like and subscribe my channel. Thank you.